Can post-operative pain medication cause addiction? Imagine waking up after surgery and feeling relief from pain. Now, some medications used to control that pain might have a hidden risk. That's what we're exploring today. After surgery, doctors often prescribe medications to help manage pain. The most common are opioid medications, which are very effective for moderate to severe pain. These drugs work by attaching to specific receptors in the brain and spinal cord, which reduces the sensation of pain. But they also cause feelings of euphoria or a high, which can be tempting for some people. This feeling of euphoria is part of what makes opioids potentially addictive. If someone takes these medications longer than necessary or in higher doses than prescribed, they might develop dependence. Dependence means their body gets used to the drug, and stopping it suddenly can cause withdrawal symptoms. Addiction is a step further, where a person compulsively seeks out the drug despite harmful effects. The risk of addiction depends on several factors. Longer use and higher doses increase the chance. If someone has used opioids before surgery, they might be more likely to continue using them afterward. A personal history of substance abuse or mental health issues like depression can also raise the risk. Certain surgeries, such as joint replacements or breast surgeries, tend to have higher rates of prolonged opioid use. Studies show that about 6 to 7 out of 100 patients who have never used opioids before might continue using them beyond 3 months after surgery. This could mean they are developing dependence or addiction. To lower this risk, doctors now focus on multimodal pain management. This approach combines non-opioid medications like acetaminophen and non-steroidal anti-inflammatory drugs with other methods such as ice packs or physical therapy. The goal is to control pain effectively while reducing reliance on opioids. Prescribing opioids carefully is also key. Doctors limit the amount and duration, often just a few days after surgery. They also educate patients about the risks, safe use, and proper storage and disposal of medications. Close follow-up after surgery helps monitor how well pain is controlled and whether the patient is using the medication responsibly. Adjustments can be made if needed. In summary, opioids are helpful for managing post-surgery pain, but they do carry a risk of addiction, especially if used longer than necessary or in patients with certain risk factors. Combining different pain management strategies and keeping doses low for the shortest time possible helps keep patients safe. Always talk openly with your healthcare provider about your pain and any concerns during recovery.